I'm James Watson, from Nebraska originally. Did my undergrad in Lincoln, went to UNMC for medical school, and when I got into medical school, actually signed on and joined the Air Force through the HPSP program. And after that, did my residency training here at the joint program between Offutt and UNMC, and stayed on at Offutt as a core faculty there for 4 years when I finished my residency training, and then just completed my active service this. Chose family medicine for a couple reasons. Number one, I couldn't make up my mind and like to do a little bit of everything, which is what a lot of family docs do. Also, just kind of the range and scope of family medicine. We do, there's a saying in family medicine, from womb to tomb, and so I see new moms who are coming in for their first prenatal visit, and I see people at the end of life in the hospital. But the big part of that first visit, I think, is just us getting to know each other. The way I see it, this is supposed to be a lifelong relationship, or hopefully so, and there are quirks about me, whether that's personality or humor or my approach to medicine, that may work really well for some folks and not well for others, and vice versa. That's a relationship, and so there's some patients who are going to have a really good experience with me, and there's some that we're just not going to fit, and that's okay if we don't fit. But I think that first visit, sitting down, getting to know each other as people, and see, are we going to be a good fit or not? Because that's going to be really important if we're going to have a good relationship and make good quality healthcare decisions for you. When I'm not practicing medicine, most of the time I'm chasing around family. I've got a wife and 4 young kids, so a lot of my time is doing that. But outside of that, I enjoy music. Played the drums, actually played on the drum line in college. My first Husker game was, I got to stand on the N because I was on the drum line, so that was a lot of fun. So do a lot of music, play piano, guitar. Would like to take up the bagpipes. It's always been a pipe dream, but never pulled the trigger on that yet. But outside of that, I do a little bit of woodworking, gotten into smoking and barbecuing and things like that. And then I read a lot, usually kind of epic fantasy things, Tolkien, Sanderson, Jordan, those kind of folks. There's very few places where we get to interact with people in some of their most vulnerable times. Whether those are really joyful times, like having a baby, or really hard times, being really sick in the hospital. And I just love the fact that I get to kind of enter into those hard moments and maybe be a positive influence or impact in those hard moments.